Me acid is a medication used to treat symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. It can also relieve symptoms of extra gas, including belching, bloating, and feelings of pressure or discomfort in the stomach. This medication works by helping to break up gas bubbles in the gut, while the aluminum and magnesium antacids work quickly to lower the acid in the stomach. It's important to note that Me acid works only on existing acid in the stomach and does not prevent acid production. It may be used alone or with other medications that lower acid production, such as H2 blockers or proton pump inhibitors. If you're considering self-treating with Me acid, be sure to carefully read the package instructions before use to ensure it's the right product for you. Additionally, it's important to be aware that some products may have similar brand names but different active ingredients and uses, so it's essential to ask your pharmacist if you have any questions about your product or its use. As for the daily dosage and optimal timing, it's best to follow the instructions provided on the package or consult with a healthcare professional for personalized guidance. To use Me acid, take it by mouth after meals and at bedtime as needed. Follow the directions on the product package or as directed by your doctor. If you have any questions, ask your doctor or pharmacist. If you are taking the chewable tablets, chew thoroughly before swallowing, then drink a full glass of water. If you are using the liquid form, shake the bottle well before pouring each dose and measure carefully using a medication spoon/cup. Refrigerating the suspension may improve the flavor, but do not freeze it. The liquid form works best if taken without other fluids, but you can mix your dose with a little water if needed. Be aware that Me acid may react with other medications, so talk with your doctor or pharmacist about how to schedule your medications to prevent any problems. If your acid problems persist or worsen after using this product for 1 week, or if you think you have a serious medical problem, seek medical help right away. And, if you are using this medication regularly for more than 2 weeks, consult your doctor to see if you need a different treatment. Some common side effects of Me acid may include nausea, constipation, diarrhea, or headache. If you experience any of these side effects and they persist or worsen, it's important to inform your doctor or pharmacist. The magnesium in Me acid can cause diarrhea, but using an antacid that contains only aluminum along with this product can help control diarrhea. However, the aluminum in this product can cause constipation. To minimize constipation, it's recommended to drink plenty of fluids and exercise. If your doctor has prescribed this medication to you, it means that they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. It's important to be aware that aluminum-containing antacids can bind to phosphate in the gut, leading to low phosphate levels, especially if the medication is used in large doses and for a long period of time. You should contact your doctor immediately if you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness. In rare cases, a serious allergic reaction to Me acid may occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed, it's important to contact your doctor or pharmacist. If you do experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. Before taking Me acid, it's important to talk to your doctor or pharmacist if you are allergic to aluminum hydroxide, magnesium, or simethicone, as this product may contain inactive ingredients that can cause allergic reactions. If you have health problems such as frequent alcohol use, dehydration, kidney problems, or diabetes, make sure to consult your doctor or pharmacist before using this product. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist about using this drug safely, as Me acid may contain aspartame. During pregnancy, it's important to only use this medication when clearly needed and to discuss the risks and benefits with your doctor. If you are breastfeeding, make sure to consult your doctor before using Me acid. When taking Me acid, it's important to be aware of potential drug interactions that could affect how your medications work. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with me acid are phosphate supplements, such as potassium phosphate and sodium polystyrene sulfonate. Additionally, antacids can interfere with the absorption of many other drugs, so be sure to check with your pharmacist before taking antacids with any other medication. Remember to consult your doctor or pharmacist if you have any concerns about potential drug interactions. And as always, follow the recommended dosage instructions for me acid for optimal results. If someone has taken too much me acid and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Make sure to attend all your medical and lab appointments as scheduled. In addition to taking me acid, you may also benefit from making some lifestyle changes. This can include participating in stress reduction programs, quitting smoking, cutting back on alcohol, and making dietary changes such as avoiding caffeine, fatty foods, and certain spices. It's important to talk to your doctor or pharmacist about these lifestyle changes to see if they might help improve the effectiveness of the medication for you. If you forget to take me acid on your regular schedule, take it as soon as you remember. If it's close to the time of your next dose, then just skip the missed dose and take your next dose at the regular time. Do not take double the dose to make up for the missed one. When storing me acid, make sure to keep it at room temperature and away from light and moisture. If you have the liquid form of me acid, you can store it in the refrigerator to make it taste better, but do not freeze it. It's important to keep all medications, including me acid, out of reach of children and pets. When you no longer need me acid or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into the drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.